Hey there, and welcome. So you're getting ready for colon surgery, and we are here to help you through it. Think of this as your simple, step-by-step guide to bowel preparation. Our goal is to make sure you feel confident and totally ready. So let's get started.
We get it. Preparing for any kind of surgery can feel like a lot to handle, and it's totally normal to feel a bit overwhelmed. This guide is here to take all the guesswork out of the equation and just make the whole process as clear and stress-free as possible.
And just remember, by following these steps, you're not just a passive patient. You're actually the most important player on the team for your own health. You are literally setting the stage for a safe and successful surgery.
So, let's dive right into the big question. Why is all this so important? Well, it really all comes down to one single thing: your safety.
First off, what even is a surgical bowel prep? You know, in the simplest terms, it's a process to completely clean out your colon. We want to make sure it's totally free of any solid material before your surgeon gets to work.
So, why do we do this? Because a clean colon massively lowers the risk of infection. And this isn't just some small detail. It is, without a doubt, the single most important thing you can do to ensure a safer surgery and a much smoother recovery.
Look, it really comes down to two very different paths. On one side, you've got a clean bowel. That means a lower infection risk and a safer surgery. That's our goal. On the other side, an incomplete prep, that means a higher risk for complications, and it might even mean your surgery has to be canceled, and that's only done for your safety.
All right, now that we know the why, let's get into the what. We're going to go through your prep toolkit. Think of it as a simple shopping list of everything you'll need to have on hand.
Here is your checklist for the pharmacy. You're going to need 4 Dulcolax tablets, 1 bottle of Miralax, that's the 238-gram one, 64 ounces of a sports drink like Gatorade, and of course, your antibiotic prescriptions. Now, a super important note on that sports drink: please avoid any red, blue, or purple colors. They can actually stain the colon, and we don't want that. Your clinic will provide you with the Impact Nutritional Supplement.
Okay, let's get into the timeline. Your prep doesn't just start the day before surgery. Believe it or not, the countdown actually begins 6 days out with a special nutritional plan.
It's a really simple 3-step plan. 6 days before your surgery, you'll start drinking 2 of those Impact shakes every day. You'll do this for 5 days in a row, and then you'll stop on the day before your surgery, because that day is the main event.
And here we are, the most critical 24 hours of the whole process, the day right before your surgery. Don't worry, we're going to walk through this timeline together, step by step.
On this day, you will be on a clear, liquid-only diet. And yes, that means no solid food at all. You can have things like water, tea, black coffee, clear broths, even Jell-O. Just remember the big rules. Avoid all solid foods and absolutely no drinks that are red, blue, or purple.
This timeline is your roadmap for the afternoon and evening. At 1 p.m., you'll take 2 Dulcolax tablets. At 3 p.m. and 4 p.m., you'll take your first 2 doses of antibiotics. Then, at 5 p.m., it's time to start drinking that Miralax solution. At 8 p.m., 2 more Dulcolax, and you'll wrap it all up with your final dose of antibiotics at 10 p.m.
So let's talk about that Miralax solution. First, you're going to mix that entire bottle into your 64 ounces of Gatorade. Stir it really well. Then, your goal is to drink 1 8-ounce glass every 10 to 20 minutes. Now listen, if you start to feel nauseous, that is perfectly okay and very normal. Just press pause, take a 45-minute break, and then get back to it.
And just to make that antibiotic schedule crystal clear, here it is again. It's the same 2 medications, Flagyl and neomycin, at 3 specific times: 3 p.m., 4 p.m., and 10 p.m. And the dosage is the same each time: 1 Flagyl and 2 neomycin tablets.
Okay, here's a fantastic pro tip that's going to save you a headache. Please try to get those antibiotic prescriptions filled at least 48 hours, so 2 days before your surgery. It's just one less thing to worry about on prep day.
You are so close to the finish line. All of your hard work and preparation is about to pay off. And this last part is all about what that means for your big day.
Once you take that final dose of medication, that's it. You've officially completed the prep. And you should know, the hardest part of this whole experience is now behind you.
Let's just circle back one last time to the most important message of all. Your safety is and always will be the #1 priority. Following these instructions is truly the most critical role you play in your own surgical success.
So that brings up a really important question. What happens if, for some reason, the prep isn't followed exactly, or it just doesn't work as well as we'd hoped?
Well, the answer is pretty straightforward, and again, it's all about keeping you safe. If your surgeon sees that the bowel isn't completely clean, they just can't perform the operation safely. In that case, for your own well-being, this surgery would unfortunately be canceled and rescheduled.
So let's end with a few key reminders. Please follow every instruction carefully. Remember that a clean bowel is absolutely essential for a safe surgery. Know that your entire surgical team is here to support you. And last but not least, if you are ever in doubt about anything, just call us.
And on that note, here's the number. For any questions or concerns, no matter how small you think they are, please do not hesitate to call the office at 540-536-3470. Your team is ready to help. Thanks so much for walking through this with us, and we wish you all the very best.